Welcome to the Long-Term Care Chronicles podcast. In this episode, in the series of eConsult, we're going to be speaking with care partner Don Sturge from Newfoundland in regards to eConsult and the advantages of that application. Let's have a listen. Thank you for coming on to the Long-Term Care Chronicles, Don. I really appreciate your perspective as a care partner. So we'll start off with you just providing a little bit of background about yourself.
Okay, I'm a retired educator in the province of Newfoundland and Labrador, and I also volunteer in healthcare at the local level, at a regional level, at a provincial level, I guess, and also at the national level with my involvement with eConsult. It was suggested to me a few years back in 2016 that I might have some interest in something, a new concept called eConsult, and I was asked if I would be willing to put my name forward as a patient care partner for the Atlantic region. I've had a number of years supporting a family member in healthcare services, and I guess maybe the person who suggested it, I put my name forward, had some understanding that I had some insights in terms of patient care, and maybe something to contribute to this to eConsult in terms of access to patient care services. So back in 2016, I attended the first eConsult meeting in Ottawa, and I think at that particular meeting there were about 60 others from across the country, physicians, research people from university, as well as maybe within the healthcare across the country, as well as a number of patient care partners. We met for the whole day and broke into groups. There were some great discussions about what I guess was my first introduction to a service called eConsult, and wondering if it's something that could work across this country of ours. So that was the beginnings.
We will then go into as to your perspective in regards to the eConsult and how that is advantageous for everyone to be using, especially in long-term care.
Sure. Well, eConsult, from my perspective, improves access to patient services in the whole population, and if there's any service that deserves equity to the population, it's certainly healthcare services. I live in Newfoundland and Labrador, as I noted earlier, and most of our provinces, we're spread out geographically, so a lot of the population is in rural, remote areas, and travel is sometimes a challenge in terms of long-distance travel to healthcare centers, involving flights, overnight travel. And so I just view eConsult as certainly an opportunity to provide better quality access care to everyone in the population. And if we think about quality in healthcare, we think about I guess the right care for the right person at the right time in the right place, and the right place certainly in terms of long-term care. I think a lot of that special population is in their home, their long-term care home, or wherever they're living. It could be in their own home, wherever they are on the continuum of living accommodations, sometimes with their own family in their own home. But eConsult is a real opportunity, and I saw this right from the beginning in serving special populations, whether it's long-term care, whether it's populations in the north of our country, the rural, the remote, etc. So I think being a bum in a seat in a physician's office is not necessarily the only way to provide quality healthcare services these days. I think telehealth, of course, the language around eConsult. Again, generally speaking, we refer to telehealth, virtual care, access. People can meet their care provider, whether it's a nurse practitioner, whether it's a family physician, whether it's a specialist, through video conferencing, online services, and my experience, it's as good as being in the room physically with the doctor or the specialist. And I think we've seen lots of examples across the country in different provinces where eConsult is really taking off in terms of its uptake and spread across this country. And I know in Newfoundland and Labrador, I've also been a part of a working group in the St. John's Eastern Health area, and I live in the central area of the province. But back in 2000, after the conference in Ottawa, back in 2017, this working group began to, I guess, to create awareness and educate people in healthcare around eConsult and engage physicians, nurse practitioners, people in healthcare around all the benefits of eConsult. And I think some of the latest data that I've seen, we have close to 6,000 eConsults in our province, and I think there are over 500 healthcare providers involved in this service, including, as noted earlier, nurse practitioners, family physicians, the specialists, and I think close to 50 specialists and specialized services are available within our province through eConsult. So I think it's growing. People are becoming aware of this great service in terms of access, and certainly as a country, we all understand. I think in terms of the G7 countries, there's lots of indicators that would show us that access to healthcare services is a challenge in our country. And I think this is a real opportunity that's a benefit to the healthcare providers, but certainly in providing the service from the healthcare provider perspective, but certainly huge benefits for the population. And I think for long-term care in particular, we think about the risk of travel, even if they have to go on ambulance outside of the long-term care homes or the home care, personal care homes. If they have to travel to the health center, it means in most cases traveling via ambulance, which we know takes a long time. It takes hours often. Sometimes it's a full day trip for long-term care patients to visit a healthcare referral center or a local health center. And there are risks around falls, there are risks around inconveniences of traveling on these ambulances, and we all know the discomforts of traveling on an ambulance. I've never had that personal experience, but I've heard of lots who have had that experience, and it's certainly not great. And I can appreciate someone who's a senior having to travel on an ambulance all day. And if we think about visiting healthcare centers, particularly around COVID infection, we think about most years we have just a regular flu. Bringing long-term care patients into hospitals and health centers where the likelihood of contracting an infection is sometimes high, and having them sit in sometimes waiting rooms, waiting in corridors for their appointments. But if we can do all this at the healthcare center and the long-term care place, they don't have to travel. And even in the winter months, we have poor road conditions or stormy weather. We expose our seniors to risk, and I think we can minimize the risk. We can provide quality care at a much higher level for the patient in the long-term care center, in their room, in their home, without them having to travel at all. And in terms of their extended family or other members of the family who might have to travel with them, it adds disruptions to their life and their family.
Absolutely.
In terms of travel, cost and inconveniences. So I could talk at length about this because I truly see all the benefits with eConsult as opposed to the traditional way of people visiting a doctor with a bum in a seat and hours and hours of travel on the highways.
No, thank you so much. I really do appreciate that. That is great. Thank you. Thank you for listening to today's show. If you have any feedback on any episode or suggestions, please contact us on our social media on Twitter @Family Councils, on Facebook @Family Council Collaborative Alliance, and Instagram @FCCA0020. Thank you again for listening.